A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, lovely to see you. Thank you so much for joining us today. And I'm so pleased to be able to welcome Dr. Renata Hines. Renata is a dentist and homeopath. So lovely to see you, Renata. Thank you so much for joining us.
Thank you for having me here, Mary. It's a pleasure to be able to do this webinar with you and Homeopathy 24/7.
And it's so lovely because obviously we can talk about dentistry and homeopathy. And so we thought we might talk about surgery and how homeopathy can help with surgery. Because, of course, a lot of people say, well, if you're having surgery, then you're having Western medicine. How can you have homeopathy as well? But it's wonderful during surgery, isn't it?
Oh, it is very, very, very wonderful, supporting the healing and before surgery, in cases where patients are very anxious, very fearful. Yes, it's a great tool. And integrating homeopathic remedies with surgical care is a great way of combining both advantages to provide comprehensive and more effective healthcare for people.
Brilliant, brilliant. Because of course, yeah, it is a complementary medicine. It can be used alongside. And homeopathy isn't instead of surgery. If you need surgery, you must have surgery. So it's wonderful to know that you can take homeopathy before and after surgery and really benefit from improved and faster healing. So let's talk about that. Anxiety before an event, before surgery, before going into hospital. Are there remedies that might be able to help us with that?
Oh yes, we have aconite and gelsemium. Aconite will have a fear of death, and gelsemium will be very, very nervous, trembling. And both of them are the main indications for people with anticipatory anxiety, almost to the fear of death. You have to differentiate in which degree the person is and then prescribe one of the two. That's right. In fact, there is a study, I think it was done in Italy, where they used aconite for children who were to go under surgery. And aconite is a typical remedy for illnesses where primary indication is a rapid, dramatic start of a shock or trauma, as well as fear and worry and fear of death, which are frequent feelings experienced by children before surgery. And in a double-blind study, aconite was administered to 95% of 50 children, and it revealed a considerably reduced post-operative pain and agitation. Arnica also is another remedy that is used for patients before and after surgery, due to its capacity to lessen bleeding and surgical shock.
Yes, of course, that makes sense. And of course, during surgery, you're going to be bruised. So it makes sense that Arnica is really going to help that recovery afterwards. So We've got remedies that we can take beforehand, and then we've got a number of remedies we can take after the surgery to help healing. So we've mentioned Arnica. What other remedies might be useful after you've had a surgery?
Yes. After you had a surgery, we have again Arnica, and then we have Ruta.
Ruta, yes.
When the surgery involves cartilage, periosteum, and is frequently used on surgery for knee and elbows.
Yes, for joints. It makes sense because it really has a resonance, doesn't it, with cartilage and ligaments, and so it's going to help there.
That's right. And then we have Staphisagria or Aesculus and Aesculus, which are used for after surgery of hemorrhoids. So again, you do that the night before, in the morning, and shortly after the surgery.
And of course, let's just say a little bit more about Staphisagria because it's such a useful remedy for surgery. It's known for slice injuries. So obviously that makes sense that it comes under surgery, but also it's known for the emotional trauma of being abused. And so if anybody is coming away from surgery feeling abused in any way, then Staphisagria would really be well indicated, wouldn't it?
That's right. So it is for this reason, it's also indicated for cesarean sections.
Of course.
Yes, and when I hear the remedy name Staphisagria, the first thing that comes into my mind is the syndrome of battered wife.
So, okay, yes. So again, that's abuse, isn't it? And that feeling of being taken advantage of.
That's right.
And then going back then, obviously, to remedies just helping the general internal healing, we might have Calendula.
That's right. Calendula helps with the healing of soft tissues, but also the internal healing in general. It's a very good remedy. I myself had to have Calendula last year when I underwent a ankle foot surgery, and that helped me a lot with the healing of the ligament after Ruta and the healing of my skin.
Yes, and of course, it's a very underestimated remedy. I think we use it for cuts and bruises and open wounds, but we mustn't forget that internal healing. It's really going to aid healing so that it happens faster and avoids infection.
Yeah, it does avoid infection. You can also apply locally. Of course, you put a few drops of Calendula mother tincture in freshly cooled boiled water, and then you can apply the wound outside locally to help even more with the healing and to avoid infections.
Are there particular remedies, let's say, for different types of surgery, for eye surgery or for gallbladder surgery, for instance?
Yes, we have Ledum for eye surgery, and we have Lycopodium, very much used for gallbladder surgery.
Yes, of course, because Lycopodium has such an affinity with the gallbladder. And if anybody suffers from gallstones at all, for me, Lycopodium is usually a remedy well worth trying. It's just amazing affinity for gallbladder and liver, hasn't it?
Yes.
So It makes sense as well. Lead them for eye surgery, and maybe also Ruta for eye surgery, perhaps, because that deals with the muscles, doesn't it, of the eye?
The tiny little muscles and also soft tissue. So yes, they are both good choices for eye surgery.
Yes, yes. Tell us about back surgery, because that back is so full of nerves, isn't it? We know that back pain and nerve ending, sciatica, that sort of thing. Have we got particular remedies that might help there?
Yes, the first remedy that comes to my mind is Hypericon. Hypericon is a remedy that is related to nerve endings. So you can imagine the back is just basically bones and nerve endings, and from there the nerves, they stretch out, they travel through our bodies. So yes, Hypericon is the first remedy that comes to my mind. Not only that, for instance, is a very much used remedy when there is phantom pain after amputation. So
Oh,
so the person is feeling pain somewhere in the body that part of it doesn't exist anymore.
yes, yeah, that makes complete sense, because I've also used Hypericum for people who are paralyzed but have nerve pain, and that's the same sort of thing, isn't it, where there is pain there, but in theory there isn't pain there.
Yes, there
Yeah.
shouldn't be. Yes.
Okay, so yeah, of course, Hypericum is a wonderful, wonderful remedy for nerve pains. We might also find that symptoms occur because of the anesthesia or because of medications after surgery. So if we've got symptoms such as constipation, nausea, vomiting, gas, are there remedies that might be worth trying then?
Yes, we have phosphorus, which is indicated for instance, when the patient had general anesthesia and feels quite drowsy for a few days, or they may even be vomiting. That's a good remedy for that, because phosphorus also is like lycopodium, is a liver remedy, acts in the liver, and counteracts the side effects of general anesthesia. And then we have again Hypericon. If the patient had to go under spinal anesthesia, and after the surgery they have a chronic back pain, sometimes even a chronic headache from the injection into the spine. And that is a good first remedy that comes to my mind, because again, the injection went straight into a place where there are nerve endings. And as we know, the nerves travel up and down to different parts of their body. And so it's taking the pain up to the head. And so that would be a good indication, Hypericon.
That's a really, really good point, and I hadn't considered that before when helping people with surgery. So thank you very much for bringing that to mind. Vomiting, yes, that's me. Whenever I've had to have anything done, that's me. What about constipation and flatulence and gas? Would that be looking at the normal way that you see symptoms?
Yes, the first remedy that comes to my mind is Raphanus, but also lycopodium and other remedies. I mean, in that case of constipation, or all the other cases, sometimes we really need to individualize the prescription, because we have so many remedies for all the ailments, that many times we have to individualize, take the modalities and the mood of the person and the local symptoms, but rough-ons comes to my mind.
Okay, that's very, very interesting. So what we're saying really is we're not just going to take the flatulence and into mind. We're going to have a look at see how you feel about this. We're going to see whether it's better or worse at certain times of day or night or after eating or drinking, and then find the remedy which most fits you for this. So it's not a one size fits all for this type of thing. Let's just quickly go through wound infection or bleeding that doesn't stop, because that of course might be something that they worry about with teeth surgery, and they're wanting to give lots of antibiotics and things afterwards.
Yes, wound infection. Again, Arnica, first remedy that comes to my mind for dental surgery. And then we have Calendula again for the healing of the soft tissues and to keep wound infection at bay. Of course, we have other remedies, but these are the first ones that come to my mind. And again, in dental surgery, we might have to go to Ruta or Opatorio when, for instance, people have implants and that deals with the bone, and we have the periosteum there and deep bone pains. Then I would think of that. For bleeding, again, we have Arnica, and we think of phosphorus. It's a very good remedy for bleeding, and two choices that come to my mind. But again, we have other choices, and it might be that Arnica and phosphorus doesn't do the trick, and then we'll have to repertorize the case and individualized.
Yes, of course. And of course, I know that you've had surgery as well, and you really did need that individualized approach afterwards. Can you just tell us a little bit about that? What happened to you with your ankle compound fracture?
That was a patient of mine, and she used to love riding her bicycle, and used to go ride for miles and as an exercise and to clear her mind. And she got run over, and an accident, not run over, but someone hit her and she fell, and she broke one of her ankles in a compound fracture. That means her ankle went into little pieces. Okay. So she was taken to hospital, and they had to put all the pins on her and keep still for many months. Mm-hmm. Eventually the pins got removed, but the holes to the bones weren't closing, and there was this it was all of them were oozing this liquid. Mm-hmm. And the doctors were a bit concerned, and eventually they wanted her to take steroids for it, but she decided not to, and she came to me. At the beginning, I gave some of the remedies I mentioned here, because I said, oh, surgery, let's try Arnica, let's try Ruta, but they didn't work. So I took her case, and I repertorized her case, individualized her case, and it came down to Colsicon. And I thought that was a very strange remedy for closing the wound, the little pinholes. Yeah. But within one dose of Colsicon 30C, the oozing stopped, and it started healing, and she was very, very pleased with it.
Amazing. So what you're saying is that if you hadn't have taken the whole case, you'd have never have thought of Corticum for that particular injury, but Corticum was spot on, and the minute she started taking it, then everything started healing. And we have one very happy client who loves homeopathy then as well, and one very surprised orthopedics specialist, I expect,
Yes.
who didn't expect that at all. But brilliant, absolutely fantastic, Renata, just going through this process with you, because just having this conversation makes us think, doesn't it? And it makes us think about what we can use off the shelf, what we need specialized help with, and where to go if we've got a surgery booked.
That's right. Yes, homeopathy is wonderful system of medicine, and it has helped so many people. I just wish that the people that were helped were a bit more vocal about it.
Tell everybody, if you've been helped with homeopathy, shout it out to the rooftops so that other people can benefit from this.
That's
Lovely
right.
talking to you today, Renata. Thank you so much for coming on, and I look forward to catching up with you again soon.
Thank you very much, Mary. Thank you so much.
Thank you, Renata. That was so useful, so brilliant just to go through surgery, because everybody always asks, what can I be taking to help recovery from surgery? So I do hope you enjoyed that session. Next week, I will be talking to Glithin Sprangle about homeopathy for teeth. Now, of course, homeopathy helping your teeth health is a fantastic topic for you to know more about. So I look forward to seeing you there. If you've enjoyed this session today, please do give us a like, make sure you're following us, and ring all the bells that you can ring to help other people learn more about using homeopathy to improve health. Thank you so much.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.